All right, good morning and welcome. It's my pleasure to interview you. My name is Jessie Resurrection. I major in business. I major in marketing management, and I minor in business law and business management. Would you please introduce yourself?
My name is Dr. Lisa Garsman, director of the BSN program. I'm a family nurse practitioner, advanced practice nurse, and I'm excited to be interviewed and speak with you.
It's a pleasure to interview you, man. So we're going to go through a few questions, but before we even do that, I'd like to check that you signed your waiver.
Yes.
Okay, that's great. Thank you. So the first question is, would you please describe your childhood for me?
So I was born in New Jersey, Montclair, and I'm one of five. So I have three sisters and a brother. I moved to Omaha, Nebraska at the age of 12, which was a big change. There's more cows than people in Nebraska. No, I'm kidding. But it was a good change. And so got me out in a very different very different from the East Coast in New Jersey. And I went to school at Iowa State. And then my parents moved back to New Jersey like 12 years later and back to Montclair. So back to things that we knew, but it was a great experience living there.
How would you say your life was different from before you went to St. Peter's?
Um, I think that I was at Rutgers for a while and I was in my clinical practice. So coming into academia, that was different for me coming to St. Peter's. Certainly I was excited to come. I came to start the nursing program in 2007. There was a great need for a 4-year nursing program in Jersey City. And so that was really coming in at the ground level and launching a program like that and having the first class graduate was very rewarding.
Sounds wonderful. And what actually brought you to St. Peter's University?
To start the BSN program. They did have an RN to BSN program up at Englewood Cliffs. Originally it had been in Jersey City. They also had a master's program for nurse practitioners, but they did not have a traditional 4-year program in Jersey City. So that's what brought me there.
Sounds great. And would you mind telling me how that program differentiates itself from others in the state?
I think that our program, because of the diversity of our students, all different backgrounds, different genders, they actually reflect more of the patient population that you see in the country. And so that, I think, is what makes us unique, as well as being in an urban area. So the hospitals that we go to for our clinicals are all teaching hospitals. They really prepare the students for to see a lot of different things. We have a lot of immigrant populations that are in our hospitals, and that they reflect the reality of the patients in the United States. So I think that makes it different. We start our clinicals spring of our sophomore year, which is different from other programs. Most programs start clinicals junior, senior year, the last 2 years.
I see. And what impact has the Jesuit education have on your life?
I think because the Jesuit education and values really emphasize caring for the whole person, cura personalis, and that's really allowed me to further carry that into my own practice. Again, like I said, our nursing students come from all different belief systems, cultures, and faiths. And I think the Jesuit mission really offers a foundation for thinking critically, engaging in personal reflection. Our students, definitely in the School of Nursing, we're preparing future nurse leaders as agents of change. So if you think Magis, right, rising above expectations, striving for more, all of this aligns really well with the nursing profession. It's that drive to make a difference in the lives of others. Social justice, or the belief that economic and social inequality, affects health and should be addressed. That's a concept that's at the core of nursing. There's a long tradition of nurses acting as advocates for vulnerable people within healthcare settings. And as nurses and my nursing students, my job is to teach them the skills to ask the right questions, understand the needs of individual patients. And that could be as simple as asking patients about their cultural and personal beliefs, their identity, understanding of their own health. And I think that comes with the Jesuit value of pursuing justice, having concern for the poor, the marginalized, and vulnerable populations.
That was a wonderful answer. Is that what brought you to nursing?
Yeah, I think wanting to, nursing is different from medicine. I mean, we work in an intercollaborative team, but in nursing, we really are focused on a holistic approach, and looking at the whole person, right? Not just the physical or not just a diagnosis that labels the patient.
I see. And what were the larger societal issues that occurred while you went to St. Peter's University? And how did it have an impact on those around you and yourself?
So I think my area of research has been with a lot of immigrant populations. So immigration was definitely, I think, one of the larger societal issues that occurred during that. Not just at my time at St. Peter's, but even more so in these last, you know, 4 to 8 years. I mean, when you think about all of our undocumented residents, that the patients that I see experience so many challenges in pursuing healthcare, English language proficiency, digital literacy, family income levels, all of the things. These people are struggling with illnesses, going through maybe one of the most difficult times in their lives. And then on top of that, they have the fear of being deported, right? So when I was doing my research in New Brunswick with a large Mexican population, the increased crackdowns by immigration, by ICE, resulted in so much heightened fear, and worry, where they weren't seeking health care. I think that was a very big one. I mean, St. Peter's is, like I said, we're preparing professional nurses. We're empowering them to be leaders of change. My seniors just finished their leadership course and are ready to graduate. And I think one of the biggest points was that in small collective actions as nurses, future nurses, being more educated and skilled in cultural competence, that's threaded throughout our curriculum. Each one of them has the potential to make like a tremendous impact, to bridge these disparities and try and improve the well-being of immigrants throughout the country. So I think that was a big piece. I mean, obviously, I can't probably not mention COVID. I mean, this health crisis, it impacted not just the frontline staff and clinical leaders, but all systems and communities. And we within the School of Nursing faced really extreme challenges, related to, our role in helping develop this next generation of healthcare providers. And we made a really difficult decision to remove our nursing students, our undergrads, from clinicals. Ethically, we had to consider weighing the value of education and aid, against the risk and strain to them personally and professionally. If our students were exposed to COVID-19 while in the clinical setting, that was risking not only their health, but that of their family. We also considered that the students, would face some financial burden of not being able to work if they had to be quarantined, and that would be a loss of income. But I do feel strongly that even with all the fear and anxiety, there were lessons of hope, right? For our students, their main concern were the health of patients, communities. In the week that followed our students being removed from the clinical setting, we can continue to do student learning online. We had virtual simulations, unfolding case studies. We did virtual synchronous classrooms. The students really shared, very insightful thoughts and honest thoughts on the impact of not only for them personally but worldwide. I mean, and we really witnessed the global impact. And I think one of the biggest things was probably the role and significance, the contribution of nurses throughout the healthcare system. So this was like a real-time lesson in equity, ethics, social justice, and patient care. And I think this will forever shift the educational landscape. And so in a way, it affected us not just professionally but personally as well.
I see. That sounds like it was a very heavy issue. And what do you believe was the impact that students received from COVID-19, what do you think they thought about the whole pandemic?
I think for many of our students that still continue to work maybe as nursing assistants because they can, as nursing students, once they've finished their fundamentals in the sophomore year, they can work as patient care technicians or CNAs in the hospital. So they continue to be in hospital settings with their jobs, many of them, and really at the front lines. And many suffered losses in their families. So I think there was a mix of feelings. Those that I don't think any of my students second guess now that they weren't sure if they wanted to pursue a career in nursing. I think they felt very proud to be future nurses coming out, and but also the reality of just how difficult situations, but also the knowing you've impacted, especially for a family that couldn't visit their loved one who was, dying of COVID complications, but that might be their only lifeline, with FaceTiming a family member, as you as the nursing assistant there to help. So I think that was a big piece.
I see. And also, I have a final question. Excuse me. And that is, why is St. Peter's University an important institution for higher learning?
Let me think about that a little bit. I think one of the biggest driving forces that makes St. Peter's really rise above other institutions of higher learning is definitely their commitment to social justice, academic excellence. Again, when you think of the Jesuit values, like care of the whole person, education is definitely more than the knowledge and skills acquired in the classroom. So to educate the whole person is to pay attention to many dimensions of ourselves that make us human, right? The emotional, the intellectual, spiritual, social, and physical. I think when you think of the other, another value, people for others. So to be educated in the Jesuit tradition is to be moved to service with and for others. And that means that learning is never for its own sake, but and our students definitely are in the community, giving back. And I think that's a huge piece. My seniors in their spring semester have their community health rotation, and they go out into the wards of Jersey City and survey it, what we call a windshield survey, talk to the community members, leaders, looking at the strengths in a ward and do they have parks? Do they have access to health care? Mass transit, busing, things like that, ways to get there, grocery stores, healthy foods. And so I think, and again, they've worked at the food banks and things like that. So I think that's another big piece. And again, academic excellence, a rigorous and high quality education. That's what you need. That's what's necessary to really achieve, the personal goals that I think our students come to St. Peter's for.
I agree with you entirely. And you also mentioned a key message earlier about a message of hope. And would you like to mention that to our audience, please?
I think that we have come out of this pandemic, still in it, a lot of us, but I think that the resilience and of communities and individuals coming together has really, there's a sense of hope and getting through this together.
I agree. And would you have any concluding words you would like for future nurses or graduates or even institutions to hear about?
I think for all students, and definitely for our nursing students, continuing their education, going on to graduate school, challenging themselves, always pushing to learn something new, develop our science of nursing. We go on for our advanced degrees, whether it's a doctorate of nursing practice, and more of a clinical doctorate, or if they want to pursue more of a research doctorate and do the Ph.D. in nursing. So I always say to my seniors, not if you go back, but when you go back, to always put me down for recommendations, and they stay in touch. And we always plan on trying to go to a conference and things to continue. I tell them I learn something new every day in my own clinical practice, even as a practitioner of over 30 years. So I think that's it.
Sounds great. Thank you so much for this interview. It was a pleasure listening to you, and you gave very excellent answers. Thank you so
Thank you.
much,
And
and I hope you
Jesse,
have a
thank
wonderful
you.
day.
And you're going on to your big senior year.
Yep.
Wow. So the light at the end of the tunnel.
Mhm.
And I know what an excellent student you are. And thank you for putting your time in. I appreciate you interviewing me.
It was wonderful. Thank you.
Okay.
All right, take care.
Take care. Thanks. Good luck.